Welcome to Accessible Customer Service 101, the Town of Oakville's refresher training on providing accessible customer service. In this video, you will learn about how everyone benefits from accessibility, what it means to provide accessible customer service, and how to interact with people with different types of disabilities. Now imagine someone with a disability comes to one of the town's service counters and needs assistance. What do you picture when you think about that person? If you pictured someone who has a visible disability, such as being in a wheelchair, that's okay, that's the image most people think of. But we have to remember that many disabilities are not visible, such as learning disabilities or autism. But don't worry, we'll show you how to interact with people of all abilities. What's important to remember is that people with disabilities are simply customers who want to work with us, and that providing accessible customer service is the same as providing good customer service. Remember, every time we interact with an individual, we leave an impression about the town of Oakville. To better understand this, here is a clip on providing accessible customer service.
As a customer service provider, openly communicating and responding to your customers' needs is the key to excellent customer service for all, and that includes people with disabilities. People with disabilities do business, shop, and travel with friends and family just like everyone else. They're the people you serve. You might call them clients, members, patients, or patrons. Accessible customer service is about treating every customer with the same consideration and respect, understanding that not all disabilities are visible, and that people with disabilities may have different needs. It's just a matter of finding the best way to serve them. It can be as easy as asking, "How can I help you?" and making small changes to your practices. Many of us will experience temporary or permanent disability at some point in our lives. Currently, about 1 in 7 people in Ontario has a disability. That's approximately 2 million people. That number is expected to increase as the population ages, as will the need for accessibility. In fact, it's estimated that by 2031, people at risk of disability and people with disabilities will represent 40% of total income in Ontario. That's approximately $536 billion. With that much spending power, it's essential for a business or organization to be providing an accessible customer service experience. It's the right thing to do, and it's the smart thing to do. By learning how to serve people with disabilities, your organization may attract more customers, build customer loyalty, and improve services for everyone. In this module, you'll learn about the customer service standard and how to interact with people with various types of disabilities.
Can you spot the barrier in this image? In this scenario, the writing is too small. If you were able to spot the barrier, congratulations. If you couldn't, that's okay. Let's try another one and see if you can spot the barrier. This one may have been easier to spot. The packages on the floor have blocked the path of the individual in a wheelchair. As you can see, some barriers are easier to spot than others. Let's quickly go over what a barrier actually is. The first and most important thing to remember is that disability itself is not a barrier. People with disabilities are able to do the same things you and I can, but sometimes they may need an accommodation. But there are barriers that exist that exclude people. Here are a few examples. Attitudinal barriers, such as assuming a person in a wheelchair also has a cognitive disability. Information and communication barriers, such as print that's too small. Physical barriers, like not removing obstacles like flower pots and boxes with supplies from pathways. And systemic barriers, such as policies, practices, and laws. After hearing about all of these potential barriers, you might be wondering, but how do I provide good customer service to people with disabilities? The first thing to remember is TALK. That's an acronym that's going to make this easier than you think. Take the time to ask, "How may I help you?" Ask, don't assume. See the person first, not the disability. Listen attentively and speak directly to the person. Know the accommodations and services that are available in your area. Using the talk method is great for serving people with disabilities, but not all scenarios are the same. Let's go over some helpful tips for each type of disability. Always remember to respect personal space. A wheelchair, cane, or walker can be an extension of a person. Ask permission before touching any items or equipment. Describe what you are going to do before you do it. And don't leave anyone in an awkward, dangerous, or undignified position. Low vision can restrict a person's ability to read signs and see hazards. When interacting with a person with vision loss, don't assume they can't see you. Many people with low vision still have some sight. Introduce yourself and speak directly to the person. Offer your elbow as guidance. If accepted, walk slowly. Lead, don't pull. Be precise and descriptive with information. For example, explain when coming to a change in elevation or at a turn. People with hearing loss may have preferred ways to communicate, such as sign language, lip reading, or pen and paper. When communicating, attract the person's attention before speaking by looking directly at them, with a gentle touch on the shoulder or a wave of your hand. Speak clearly and keep your hands away from your face. If possible, reduce background noise and ensure proper lighting. Direct your attention to the person. If a sign language interpreter is present, try not to be distracted by their presence. An individual who is deafblind may have both hearing and vision loss, or some degree of both. Many people who are deafblind will be accompanied by a support person. The support person is likely to explain how to communicate with them. Remember to always speak directly to the individual, not the support person. Cerebral palsy, stroke, hearing loss, or other conditions may make it difficult for a person to pronounce words or to express themselves. When interacting with someone who has a speech or language disability, don't assume. If you don't understand something, politely ask again. Give the person the time they need to get their point across. Try to ask yes and no questions, and use pen and paper if necessary. Learning disabilities, such as dyslexia, can affect how a person takes in or retains information. Remember, when interacting with a person with a learning disability, take your time and be patient. Speak clearly and directly using plain language. And provide information in a way that works for them, such as providing one piece of information at a time. Explain materials or use a pen and paper instead of spoken word. Developmental disabilities such as Down syndrome can mildly or greatly affect a person's ability to learn or communicate. Each situation will be different, so never assume what the person can or cannot do. Take your time and be patient. Speak clearly and directly using plain language. Provide one piece of information at a time. And use simple concepts to explain information. Did you know that 1 in 5 Canadians will experience a mental health disability at some point in their lives? Mental health disabilities include depression, acute mood swings, anxiety, and hallucinations. When interacting with a person with a mental health disability, you should always treat the individual with the same respect and consideration you have for everyone else. If someone appears to be in distress, ask them to tell you the best way you can help. Respect the person's personal space and take your time and be patient. Individuals with autism spectrum disorder may have varying levels of difficulty with communication, social interactions, and restrictive and/or repetitive patterns of behavior. When interacting with people with autism, remember that the person may not understand or have awareness of social norms, for example, recognizing personal space or speaking out of turn. Also, the person may not make eye contact when communicating, so don't assume they are not listening to you or engaged. If necessary, try using visual supports to convey your message, such as gestures, pictures, or text. And as always, take your time and be patient. As mentioned earlier, people with disabilities may use a variety of supports and accommodations, like a support person, service animal, or an assistive device. Let's take a look at a few of these. A support person is someone who assists an individual with a disability. They can be a paid worker, family member, friend, or volunteer. If someone has a support person helping them, remember to speak directly to the individual, not their support person. If you are not sure which person is the customer, simply ask. When a support person is required due to health and safety reasons, make sure to discuss it with the individual and find alternatives where possible. Did you know all of these animals could be considered a service animal? Yes, even the bird. So how can you tell if it's a service animal? Well, first, the animal should be easily identified through visual indicators such as a harness or vest. If it's not easily identifiable, politely ask the person for documentation from a regulated health professional. The document should state the individual needs the animal because of their disability. It is important to remember that the person is not required to disclose their disability or demonstrate how the animal assists them. For a full list of eligible health professionals, see our customer service procedure on oakville.ca. There are many reasons someone might need a service animal, such as a person with vision loss who may use a guide dog to get around. Other service animals are trained to assist people who have seizures, autism, or other types of disabilities. When interacting with a person who uses a service animal, remember, if you're not sure the animal is a pet or a service animal, just ask. Although most of us like to pet animals, remember it's working, it's not a pet. The owner is responsible for their care and supervision. However, you can provide water or advise where relieving areas are if the owner requests it. An assistive device is a piece of equipment used to help people with tasks of daily living. Examples of assistive devices include wheelchairs and walkers, tablets and phones, hearing aids, white canes, and TTY phone lines. It's important to remember to always ask permission to touch or handle any personal assistive device. Before we move on to some of the other accessibility standards, if you are ever unsure of how to interact with someone with a disability, remember to use talk. Take time to ask, "How may I help you?" Ask, don't assume. Listen and speak directly to the person, and know the accommodations and services that are available. That completes the town's accessibility training. Now help us welcome people of all abilities to the town where everyone has a chance to participate and enjoy what we have to offer.